Today, we're going to be talking about new research that really gives us some huge insights into why we are diagnosed with multiple sclerosis. Like, why do we become infested with these parasites? If you have been following my work, you know that I've shared a lot of evidence that multiple sclerosis is an infectious disease caused by a parasitic infestation. And many of these parasites are located in the central nervous system. But today we're going to talk about researchers that found this particular type of bacteria that produces a neurotoxin that actually causes our brain to be leaky. So we normally have this brain barrier that really defends our brain, protects it from all kinds of poisons and toxins and parasites. But for some reason, with multiple sclerosis and probably other neurological diseases where we have lesions in the central nervous system, we have a leaky brain. And this really helps us to understand why we can have a leaky brain. If we haven't met, my name is Pam Bartha, and I'm the author of Become a Wellness Champion and the founder of Live Disease Free. And I'm really excited to share this topic with you because we're getting closer and closer to really unraveling the mystery of multiple sclerosis, but other chronic diseases also. Maybe we haven't met before. I was diagnosed with multiple sclerosis 35 years ago. And back in that day, I didn't have a coach. The wellness revolution really hadn't started. And I was really on my own. But by the grace of God, I learned early on that multiple sclerosis was caused by parasites. And it took me a long time to get to this place of the understanding that we have. And now, 35 years later, I have been MS free for all that time, but also had the amazing privilege to coach hundreds of wellness champions from all over the world, helping them to recover from multiple sclerosis, but other chronic diseases also. And we have discovered, many of the different types of parasites that infect the central nervous system. We're going to talk a little bit about that today, but I'll refer you to other blog posts that I did in a lot more detail. But the relevance of this research that I'm sharing with you, it's a 2023 study. And what they did is they looked at people that were diagnosed with multiple sclerosis, and they found that people that have MS, they have a much higher abundance of this specific type of bacteria and the neurotoxin that it produces. And this neurotoxin causes a leaky blood-brain barrier, which would allow all kinds of things to enter the central nervous system that should not enter. And so there's more that I want to share that's just crazy about this research, but it's all of this that I share with you is really helping you to see that MS is not a mystery. We know that it's an infectious disease. We know it's caused by different types of parasites. So let's start off by just reviewing that MS is an inflammatory disease, and all chronic diseases, all autoimmune diseases they are inflammatory conditions. So inflammation is occurring in our body when we have chronic disease. And the immune system's job, its primary job, is to defend us from infection. So when we're dealing with diseases, so this is not an injury where you fall off your bike or you get in a car accident. So in disease, when we have inflammation, that is our immune system trying to get rid of certain types of parasites. And just like what we would see if there was a war going on and our soldiers were fighting the enemy, that war is inflammation. And the soldiers are trying to defend us from the enemy. So just kind of think of it like inflammation is the war zone. And with multiple sclerosis, what's really fascinating is that there is this blood-brain barrier. So it's basically what comes into the central nervous system through the blood. There is a barrier there. So it won't let just anything cross the blood-brain barrier. It's very, very selective to protect our brain and our spinal cord from enemies, from different types of, especially the infections, but also toxins. But what they find in multiple sclerosis is that the lesions that form in our central nervous system, and that's what they're looking for with the MRIs, they are forming around blood vessels that are in the central nervous system. So something is getting past the blood-brain barrier and getting into our brain and our spinal fluid or spinal cord for sure. So, what's really well understood is that people that have multiple sclerosis have gut dysbiosis. And you've probably heard me talking about gut dysbiosis many times. That means we're out of balance. We have too many disease causing microbes and not enough health promoting microbes in our digestive tract. And then we're in a position where, when you have too many parasites, then you start to get a lot of symptoms. So there's a disruption in the microbes that live in the gastrointestinal tract of MS patients. This has been well established in science. But the researchers, they don't know what kind of parasites could cause MS. They know that the microbes are out of balance and they suspect, and that's why they're looking at bacteria, they're considering viruses. They're really not looking at a lot of parasites, which is really sad because there's a lot of other bigger parasites that are causing a lot of the neurological symptoms also. But I shared a study, I think last week or the week before, basically, again, a 2023 Canadian study where they found that bowel problems in multiple sclerosis are super common. They're way more common than in healthy people. So people within 5 years before their first MS attack, at least 5 years, that's how far they went back. For myself, I know I had bowel issues for years. How about you? Did you have any bowel issues before in the years, like constipation or bloating or stomach aches, different types of digestive complaints and disorders? So people that were diagnosed with multiple sclerosis, if they looked 5 years before their diagnosis, there was a significant number of them that had bowel problems before. So I believe that the dysbiosis is really happening at it even before we get disease, and it really depends on which kind of parasites we have as to what kind of disease that we're going to get. So if you want, after this, you can go to our website, livediseasefree.com, and you can look up the blog post that says bowel problems in multiple sclerosis. It's just in the last week or so. And then I shared another study, or this is one that I haven't shared yet, where they looked at twins, right? Where there are two twins and one comes down with MS and the other one does not. And so what they did is they took they basically took the microbiome, or the microbes that live in the intestines of the healthy and sick twin. They put them in separate rats, so almost maybe like a fecal transplant for the rats. So they basically gave the microbes from a healthy twin into one mouse, and then from a twin that had MS into another mouse. And they did this for 34 pairs of people that had, like, where one person had MS and the other person didn't. And they found that transferring the microbes that live in the intestines, in the GI tract of the one twin that had MS, when they looked at all 34 of the different twins, the pairs of twins, I should say, they found that the person who had MS, they significantly increased the risk of the mice developing MS-like symptoms also, where it's called central nervous system specific autoimmunity. Those mice had that way more often than the healthy twins, like the microbes from the healthy twin put into a mouse. Those ones were a lot less sick, like tremendous difference. So that gives us more evidence that there's something growing in the intestines of people that have MS, and that can be transferred to other animals, and they can have these, and they call it autoimmune, but it's like inflammatory, central nervous system inflammatory conditions, right? So the case studies show that long-lasting remission of MS patients. That's another study that I wanted to share, that they've actually looked at giving people that have, and I've talked about this before, like fecal transplants for MS. And I'm sure that I have for sure videos and probably a blog post on our website about that also. But you can do some research on fecal transplants and multiple sclerosis. And there was one study I found that they looked at 3 people that were given the fecal transplant. So they had multiple sclerosis and they were given fecal transplants because they had constipation. So they were not thinking that they were going to cure the MS, but all three of them had, many, many years. And some of them were, I think, like 15 years. And another person, it was just like 3 years because they probably would have gone longer. But they were basically in remission after having a fecal transplant. So that tells you that something very, very powerful is going on in the intestine of people that have MS. So again, we know that MS is linked with a much higher incidence of gut dysbiosis. Our microbes are out of balance. And then when we look at different studies where they take the stool from an MS patient and put that into an animal, there's a much higher risk of developing these neurological diseases or symptoms like MS. And then when you're giving the stool from a healthy donor, and good luck trying to find a healthy donor, but when you take that stool and give it to a healthy donor, then some of those people not only relieve their constipation, but they're also having a remission of a lot or all of their MS symptoms. So those are like, that really helps you to see. And there's so much more that I can share with you. Like Dr. Perlmutter wrote a book called Brain Maker, and he talks about fecal transplants there. I'm not a huge advocate of fecal transplants because what I have seen is that for a lot of people, if you're lucky enough to find a healthy donor, that means somebody who doesn't have a bunch of parasites, like you could infect yourself with their parasites. But then if you have a lot of the bad parasites that are very well established in your body, then very often the fecal transplants won't last indefinitely and you have to keep getting more fecal transplants. And I've seen that with a few people. Actually, one of the case studies in Dr. Perlmutter's book, he was one of my students. So the fecal transplants helped him for a while, but then eventually they weren't working. And so then he decided to treat the parasites. That's a much better way to go. And of course, we do want to rebuild the good microbes after, for sure. So we definitely have a disruption in the microbes in our body when we have multiple sclerosis. And another really big thing that I've been sharing with you in research is that the blood-brain barrier in MS patients has been compromised. So it becomes leaky, and things that should not go into the central nervous system are moving into the central nervous system. And that's a really big problem. And when we have MS, we usually are diagnosed with an MRI. So they're finding lesions, which are pockets of infection, pockets of inflammation. Those lesions are always centered around a blood vessel that goes into the central nervous system. So yes, we need the blood vessels going into the central nervous system, but they are usually really like they only allow specific things to go through, right? So it's very selective with what things are allowed to cross from our blood into our brain and our spinal cord. And so for healthy people, this is a very important thing, that our blood-brain barrier protects our central nervous system. But there's certain bacteria that can produce toxins that can really impact the permeability of our central nervous system, so of our blood-brain barrier. So I wanted to talk just for a minute about Clostridia species. So it's a type of bacteria, and I want you to understand how nasty they are. So Clostridia it's a group of bacteria. A lot of them are anaerobic, meaning they don't like oxygen, which is good for us because we can use oxygen therapies to help get rid of them if we can reach them with the oxygen therapies. So they're very sensitive to oxygen. Not all of their strains, but many of their strains are. And there are some types of Clostridia that are really impacting human health. So I'm going to talk about really quickly about 3 or 4 of them so that you can go, oh my gosh, they're nasty. They're really awful. They're linked with, some researchers think they might be involved in ALS and for sure in autism and probably many different types of chronic diseases. So one of them you might have heard of, it's a Clostridia species that causes botulism. And botulism is, the toxin is botulinum toxin, and it is really, really toxic. The type A is 1,000 times more toxic than the tetanus toxin. And some of the symptoms of botulism, of course, it's food poisoning, but also the neurological symptoms can include lip trembling, drooling, so the inability to swallow saliva gathered in the mouth, and also where your vocal cord is paralyzed, difficulty in articulating, weak jaw, and facial muscles, pharyngeal muscle weakness, weakness of the trunk, extremities, and smooth muscle, and eventually paralysis. That is the Clostridia strain that causes botulism. The next one is the Clostridia strain that causes tetanus, and this can be fatal. So the botulism can be fatal, and tetanus is often fatal also. So this toxin is produced by bacteria that primarily affect the central nervous system. Symptoms can include, so this is for tetanus, facial stiffness and sudden involuntary muscle spasms, often in the stomach, painful muscle stiffness all over the body, trouble swallowing, seizures, jerking, headaches, fever, sweating, changes in blood pressure and heart rate. So that is the Clostridia strain that causes tetanus. And then the third one is C. difficile. So the Clostridia strain, and the species is called difficile. So that's the strain of it. And this is actually the bacteria that killed my father-in-law. And very often it's really, and with a lot of these Clostridia species, it's the overuse of antibiotics is why we end up having a really huge infection of them. And so C. diff is deadly to people that, where their microbiome is really disrupted, especially from antibiotic overuse. So it's very common in hospitals, and it can cause diarrhea and colitis and complications of systemic toxemia that it causes, hypertension, hypotension, multi-organ failure, a buildup of fluid in the spaces of the abdomen, a buildup of fluid in the layers of tissues that line the lungs and chest cavity, pulmonary arrest, different abscesses, bacteremia, skin and soft tissue infections, abdominal compartment syndrome, acute respiratory distress syndrome, multiple organ dysfunction syndrome, and renal failure. So these are really this is a really nasty group of bacteria. They can cause a lot of neurological. So yes, like if there's food poisoning involved and gangrene, I didn't even talk about that one. They can cause gangrene. So this is a very nasty type of bacteria. And they're finding one species in particular in a higher abundance in people that have multiple sclerosis. So that is called Clostridia perfringens. And it produces a certain toxin called the epsilon toxin. And this specific Clostridia that they found that's in an abundance in MS patients, it can cause a lot of human diseases. It's also a cause of a type of gangrene, food poisoning, diarrhea. It likes to live in the small intestine, and it causes all kinds of other diseases. So it can produce 17 different poisons, but there are 6 groups of poisons that are a major concern. And of those toxins, we're just talking about the epsilon toxin that this specific Clostridia species will create. So how are we exposed to this bacteria? Well, through food, but also through pests, but also through the environment. It can be even through soil. And if we have a healthy ecosystem, if we haven't been on a lot of antibiotics, and if we have lots and lots of health-promoting microbes, we have a healthy, diverse, thick population of health-promoting microbes, then these type of nasty bacteria cannot establish themselves in our digestive tract. But many of us have been on too many antibiotics, can just even be a few antibiotics, and that is really the biggest factor that disrupts our ecosystem. It devastates our health-promoting microbes, and then we're susceptible to these types of bacteria becoming established in our digestive tract. And what they do is that this one type of bacteria, it loves to live in the small intestine, and it does produce this epsilon toxin at certain times. So there are times when it's more active and times when it's less active. So times where it's producing more poisons. But one thing that I found really interesting, and this could be, I'm not saying this is the only bacteria that we would have out of balance, but looks like this is one that is quite commonly out of balance in MS patients. So when consuming a lot of carbohydrates, that leads to a lot of gas production in the intestines and a slowing down of the normal flow of the partially digested food. And this can help the bacteria to establish itself. So most of us that have MS and other chronic diseases, we've got a lot of constipation. And this is just one bacteria that can slow things down, causing constipation. That way it's allowing the food to kind of go more slowly past it. So it's going to have more food and it can establish itself better. And it produces more toxins in that event. So that's why the Live Disease-Free diet is so incredibly helpful, because we're decreasing the food to these types of parasites. And I share that all the time. So if you don't know anything about the Live Disease-Free diet, make sure to check it out. You can even go to our website, livediseasefree.com. You'll find the guidelines there. You can just even do a Google search, Live Disease-Free guidelines, and you'll find it there. There's a short video, 3-minute video. Then there is also a cheat sheet that'll get you started. And then I have lots of videos on YouTube and Facebook about the diet. So if you want to find out a little bit more detail about what I eat for different meals, you'll see that there. That is why going low carb is really important. It's not just this bacteria, but many, many other parasites. They thrive on carbohydrates. And so this epsilon toxin, it occurs in our blood. So it moves, so the bacteria, this Clostridia strain, lives in our intestines, the small intestines, and this toxin, it goes through the lining of the small intestines into our blood, and it's small enough that it doesn't really cause a lot of damage. And so then it really has a high affinity to the cells that protect the central nervous system. So the epithelial cells that protect the central nervous system from allowing all kinds of things to go through. So the toxin makes its way to the blood vessels in the central nervous system, attaches to receptors on these cells that are acting as the blood-brain barrier. This increases the permeability, so the brain then becomes leaky, and then whatever parasites are living or toxins in our blood, many of them can cross into the central nervous system. So this could be one really big factor, what makes us different from maybe somebody who has parasites, but their blood-brain barrier has not been compromised like ours has. So again, these researchers, just some of the highlights of what they found. They first wanted to see, is there an association between this type of bacteria that produces this neurotoxin, this epsilon neurotoxin, and yes, they found an association. Then they wanted to see, so is this association only like higher in, like maybe it's the same in healthy people. Maybe it's not just in MS patients that they find this bacteria that produces epsilon toxin that breaks down the blood-brain barrier. Maybe they find it in healthy. So they had to see, like, do we find it more in MS? And yes, they find the bacteria and the toxin in a much more abundance. I actually saw up to 74% in one study, and I think 61% in another study of MS patients. So very significant. And then they wanted to show, like, does this toxin induce like this inflammatory demyelination and in different locations? So I want to stop for a minute and I want to share, this is crazy. So the way, like, researchers, they want to study MS. And so they're like, well, we have to somehow make a model of MS. So what they do is they take mice and then they take these mice, specific mice, and they inject them with this toxin, pertussis toxin from the whooping cough bacteria. So they put this toxin in these mice, and then they add this myelin antigen, and then they end up getting these mice get sick and the mice end up with lesions, but more so in the spinal cord, which is not as characteristic of multiple sclerosis. But I mean, even if you're thinking like, if you're a researcher and you're like, well, if I put this neurotoxin or this pertussis toxin, I'm injecting it into mice and I'm getting these, and they call it EAE. That is the mouse model of MS, is EAE. And it's like, well, if I inject this toxin into mice and putting in, giving this myelin antigen, and I can kind of get these lesions forming, and the mice will get similar, not exactly the same, types of lesions, but very similar. It's like, why are we not looking at infection? Because that's like the toxin from whooping cough. Like, why are we not looking at other types of bacteria, right? Like, why? Because there's no money in it. Anyhow, so now what they did is they took this epsilon toxin. And so instead of, looking at the mouse model of EAE, where they take the pertussis toxin and put the myelin antigen, inject it in these poor mice, and then they get this like MS type disease. When they use the epsilon toxin with the myelin antigen, they end up getting this beautiful distribution of lesions similar to MS in different parts of the brain. And it's like, duh. So, like, it's just so incredible. And, how long is this going to take before it's going to be meaningful for the people that are suffering? It's going to take a very, very long time, unfortunately. But so, again, so when they take the epsilon toxin that they're finding in MS patients more abundantly than healthy people, because it's being made by that specific strain of Clostridia. And so when they're taking that toxin and injecting it into mice with the myelin antigen, they're getting a much closer model of multiple sclerosis than with the pertussis toxin, the one that came from whooping cough. Pretty crazy stuff. So they found again that this toxin produced an inflammatory demyelination in active EAE, so the animal model of MS, more closely resembling the lesion distribution normally found in MS when compared to the traditional way that they, you know, set up EAE in animals or create EAE in animals. And then the last thing was just that those cells that line the blood vessels in the central nervous system that really control what goes into our brain and into our spinal cord, they found that the epsilon toxin, it caused certain genes to be expressed that altered the blood-brain barrier. So they basically directly found that, yes, this toxin alters the blood-brain barrier, selectivity, the leakiness of it, so the permeability of it. So it's really, really huge. So again, it's not that this one strain of Clostridia is, maybe if it's in the central nervous system, it can cause lesions too. I don't know. That's not what the study was looking at. It was just like, this toxin, it looks like it really causes leaky brain, blood-brain barrier. And through the research we've shown, we know that when we have multiple sclerosis, we've got fungus in the central nervous system. We've got Borrelia in the central nervous system, which is the bacteria that causes Lyme disease. We have these juvenile tapeworms developing. We have the tapeworm larval cysts in the central nervous system. We have these small filarial roundworms. It's like, why? Right? And this is one thing that really, the one bit of research that really helps us to understand why we might be different than other people that don't have MS but have parasites. So that is really, really huge. And a few things that we can take away from this, and again, we always want to, get to know our enemies, right? And so the enemy this one likes to live in the small intestine. So that means that if we're doing the oxidizing enemas, that's not going to reach them very well, right? That's only going to reach the large intestine. So yes, it might get rid of some of the toxins and the bacteria in the large intestine, and it's incredibly helpful for other parasites. So it's still worth it, but we have to know if we want to get down to the root cause and get to where the problem is occurring, it's in the small intestine. if we have this bacteria. And so then we have to treat from the top down, because we wanted to talk a little bit about treatment. So it's sometimes like I really like herbs for bacteria for sure. I'm not in love with antibiotics because that's why a lot of us are in this position. But I mean, if it cured somebody, if it was really effective and cured them, that would be great. But with C. difficile, again, my father-in-law died of C. difficile, and that's one of the strains of Clostridia. It's nasty. And he was on antibiotics. He was on IV antibiotics, and they kept switching and switching and he died. So antibiotics are not always the answer, but the herbs can be really helpful. And I think it really, again, requires a layering of therapies. And what I mean by that is using like a combination of things. So, of course, with our Live Disease Free plan, the first step, I'm going to go to your questions if you guys have any questions, but I'll just finish this off first. So, number one, we have to stop feeding these infections. And so, even just with this one bacteria, it loves carbohydrates. So, when you decrease the food to the parasites, they're going to produce less toxins, less gas, they're less active, and we start to feel a lot better. We have a lot of symptom improvements. We want to support the body because remember I said that they're slowing things down. Not just this bacteria, but worms and others are, the parasites are really slowing things down, or they're causing a lot of diarrhea, one or the other, or alternating. And so this is where we want to support our body. Like if we're constipated, we want to get the bowels moving before we start treating. And if we're dealing with diarrhea, we're avoiding all raw vegetables, avoiding the vegetables that don't agree with us, going low carb, and we find that diarrhea settles right down also. And then we are supporting the body, looking at our blood work. Sometimes we're anemic. Sometimes we have low B12. Sometimes we have low thyroid. You know, it could be different things. So we want to support our physiology and work on a few things in our environment as far as the EMF, RF radiation, decreasing that, making sure we don't have mold in our home, and making sure we're sleeping well, right? All of these things are really important. And so we're feeling a lot better before we start treating. That's a really important thing. We want to feel better before we start treating. We want our immune system to have some relief so it can help us in the fight. The next thing we do is treat, right? And this is where, you know, what I'm sharing with you today, and this is coming from personal experience, is that when I've passed the really big worms and the flukes, it's life changing as far as symptom improvement. So they're a really big part of it. But we definitely want to also address these nasty pathogenic bacteria that are parasites also. And so with that, antibiotics, you know, this is if you're working with your practitioner and you can find something that works. But again, they have not been proven to be very helpful. And to be quite frank, this is probably why we're all in this boat, is because for myself included, too many antibiotics were used when I was a young child and a teenager. And that's what disrupted my microbiome. And then I was susceptible to possibly these bacteria and others. So the different types of herbs are antimicrobial, but then we can also use oral, the oxidizing agents orally that helps to clean our blood. So we're just wherever we can take the burden down for our immune system is helpful. And then also there are strains of microbes that are, and you'll probably see this coming up more and more, they're called spore-bearing bacteria. And so there are certain strains that will go after Candida and certain strains that will be really anti-Clostridia. And so herbs, great. And then the oxidizing agents, absolutely, the oxygen type therapies. And then also the prep phase is the first step, right? And then using these things. And so oxidizing agents, herbs, and the probiotics. So there are different microbes, again, that will target certain, like there's good guys that will target bad guys. And then also rebuilding our natural defense. So this is where we really like raw sauerkraut. The absolute best is homemade raw sauerkraut. It helps to repopulate our microbiome. So as we're decreasing the bad microbes, we do want to increase the good and build them back up again. And so we do want to protect the integrity. We want our blood-brain barrier to be secure, so it's not allowing these different parasites into the into the brain. Very important, into the central nervous system. So They also found that there were other like strains of Clostridia that did not have this epsilon toxin, and they couldn't find them. They were not really likely to be involved with multiple sclerosis. So they did a screening where they found 61% of the MS patients that they looked at had this epsilon toxin, and only 13% of the controls did. And they mentioned that it's not probably 100% accurate when you're looking at the stool, because again, these bacteria are living mostly in the small intestine, not in the large intestine. So all in all, they found that this epsilon toxin produced by a specific strain of Clostridia bacteria was significantly associated with MS versus healthy people. So much more prevalent in MS subjects. All right. So I'm just going to see if you guys have any questions for me. Stacy, hello. Why don't the doctors see this? It is so frustrating. It is so incredibly frustrating. I really believe that our medical schools right now have been hijacked, and our doctors are only seeing information that relates to the use of MS drugs. And they're not learning about diet, they're not learning about health. All they know, especially the neurologists right now, is that they're studying in school. They're just getting the studies from the pharmaceutical companies about the MS drugs. And as long as we can keep this gig going that, oh, it's your immune system that is attacking your nerves, that theory really supports the use of immunosuppressive drugs. So as long as they can shelter the practitioners from all this research, like I've shared, it's not a theory. Like Dr. Alan McDonald found these roundworms, the very small ones, in 10 out of 10 MS patients. He also found the juvenile tapeworms growing, so like little immature tapeworms growing in the central nervous system. There's lots of studies, like 100 years of a spirochete like Borrelia in MS. There's over 100 years of Babesia, a malaria type protist in MS, like many, many studies. So there's where they're finding fungus, like even in the brain cell, in the nucleus of the brain cell, they're finding fungus. So all this evidence is there, but the problem is that what we think healthcare is not healthcare at this time. It's sickness management. It's keeping us on these immunosuppressive drugs as long as our body can handle it. And so I'm not against pharmaceuticals. There's a time and a place. Crisis intervention, they can save your life short term, get the job done. But when we're talking about diseases like multiple sclerosis or any other autoimmune chronic disease, we're not treating the parasites, the infections, the disruption to our microbiome. We are solely just suppressing our immune system. That makes us weaker. I've heard several doctors say, and researchers, like, if you have parasites and you're suppressing your immune system, that is a dangerous thing to do. And that's what all of the immunosuppressive disease modifying drugs do, is they suppress our T cells, our B cells, keeping them out of the central nervous system, or keep locking them in our lymph nodes, etc. And so it's dangerous. In my humble opinion, it is very, very dangerous when we do that. We should be treating the cause. So why the doctors don't see this is that they're not given this information, and they're told that MS is not caused by infection. They really believe that they're getting the best science, and they're not, unfortunately. And there's the whole field of studying the microbiome is the most heavily researched topic in science today. It is, for sure. Hello, Wendy. Mike. So you're in an MS flare right now. Your neurologist is no help and wants to do an MRI test again. And double vision, walking, let me just see here. MRI test, double vision, walking, going on 6 weeks, not getting any better. So it's affecting your mobility. You're getting really tired of seeing specialists with no help. So my heart goes out to you, Mike. It's just brutal what's going on. And I was going to pull, I was going to pull some successes. Like right now, there is an amazing group. Always there is. Like I've been doing this for 10 years, but there's this very large group of wellness champions that are recovering from MS, and the successes they're having every week. We had one gentleman just started a week ago. He's in a wheelchair, and I literally brought tears to my eyes just hearing his successes already in 1 week. Like it's just shocking. And can I promise he's going to walk again? Like he has no muscle left on his bones. Like it's brutal what we're going through, and this should not be. And that's why I do this work. That's the only reason I do this work. It is a lot of research on my part. I really hope that if you find these topics helpful, that you will share this with different groups, with different doctors. But we have to bring change. This enough is enough. So Mike, if you're happy with the care that you're receiving, carry on with it. If you're fed up with it, then make sure to watch my masterclass training, learn more about the infection, start to change your diet. If you need help, we can help you with the Live Disease-Free plan. It is a plan that is proven to help you treat these parasites and get on with your life. And then, have you tried an all-meat diet? So there is a carnivore diet, and let me just backtrack. What I have noticed with my students is if they eat too much animal protein, they feel a lot worse. If you eat a lot of animal protein, it can be converted to sugar in your blood. So the carnivore diet, like if you know what you're doing and you're eating, it's mostly fat. Most of your calories are coming from fat. That for some people it can be helpful. But please remember that the reason that people might notice benefits from the carnivore diet is because you're dealing with parasites. So the carnivore diet will not get rid of the parasites. It might just help you to control your symptoms better. But people that are on the carnivore diet, they still have symptoms, maybe less, but they can still have symptoms. And it's really hard to stay on it. Like you're so restricted. What we have found is that just having moderate amounts of animal protein, lots of healthy fat, but just having a small amount of low carb, not a small amount, but having certain low carb vegetables, people tolerate that because it's low carb. And then it's just a much more enjoyable diet. There's a little bit more nutrition involved. If you're doing carnivore, you should probably have some liver every week. Otherwise, you're not going to possibly get all of the different vitamins, etc. But I'm not against carnivore. Like I have some students that joined that they couldn't eat anything. They were just so sick. But by the time they're ready to start treating, like one of the ladies I'm thinking of right now, within like 2 or 3 days of starting to treat with parasite roundworm medication, she was already starting to eat at least 5 to 7 different vegetables again. And she couldn't do that before. And that was with a roundworm medication. And that was just 2 or 3 days of starting that. So if you find you don't tolerate a lot of foods, then yes, carnivore can be helpful. We like the Live Disease-Free diet just because it's much more enjoyable. We still get tremendous symptom improvements, like tremendous symptom improvements where, people have less spasticity, they have better balance, their bladder has improved tremendously. We've had several students where their double vision just corrects on its own, on and on and on. So, you got to do what works for you, but just bearing in mind that you're dealing with parasites. And until you treat the parasites, you'll be stuck living on a very restricted diet forever. But I can tell you personally that once you treat well enough, you can start to actually eat more carbs again. I don't eat like traditional North American diet, but I can definitely eat a lot more carbs now than when I was treating, and it's absolutely fine. So would ozone kill Clostridium? Yes, it would. But again, um, you can't reach it in your small intestine well enough, Stephanie. So you could do a rectal insufflation and that'll reach your large intestine. And you can do IV, and yes, you'll get some ozone into your blood, but then it's got to travel all the way down to your small intestine, and then it's got to cross the intestinal lining and be strong enough to kill all of the Clostridia there. So this is the nice thing about when we start to understand which of the parasites are causing the problems, then we know where they like to live, what they're sensitive to, then we can start to build a better game plan of treating. So that's why it is more helpful to definitely treat orally where, something is going to be going through the small intestine for sure. I mean, it doesn't hurt to do ozone, but the oxidizing agent that we use is a lot cheaper than ozone, and you can dose throughout the day. You can use enemas with it. You'll find more information about that you can just go to the Live Disease Free website, and there's oxygen therapies in treating parasites. And you can also find that on Rumble because that's a more sensitive topic that I cannot talk about here. So that is a lot cheaper than ozone. I like ozone. You can use both the oxidizing agent that I recommend and ozone together, but I have an ozone generator and I don't use it anymore because the other one is just so easy and you can do a lot more with it. You can treat a lot more effectively with it, in my humble opinion. You're very welcome. Thank you for your kind words. Hello, Tracy. So you were on IV antibiotics for 7 months. I'm so sorry to hear that. At 30 years old, and then another 5 months with oral antibiotics and for osteomyelitis of your hip. I'm so sorry to hear that. So you probably, I don't know what you're dealing with, but as far as conditions, but you probably have some type of symptoms that you would like to correct, and your answer will be to be correcting the microbiome, to making sure that you get the bad microbes, the parasites down, and build up the health promoting microbes. Hi, Joanne. Yes, you agree. The one drug that you mentioned is causing more issues than helping. So right now there's an old chemo drug that's really, like, I've been doing this for a long time. And when it was first introduced, it was like only given in like severe cases because it's a chemo drug and chemo drugs can cause cancer. But now everybody's getting this drug, and these drugs are being billed out. Like, I think this one is like a couple $100,000 per year. And it's an old chemo drug, new name, new purpose. And I think it's not just for MS, but probably other conditions, maybe like Crohn's or arthritis too. And there's a lot of other of these chemo type drugs. And some of the other MS drugs, like, they've gone up a lot in the past few years. One of them is like $30,000 to $40,000 per treatment per month. It's insane. So yes, there's lots of money to pay these doctors to prescribe, to give them. One of my students this week said that her doctor gets these really wonderful trips to Europe every year for prescribing certain medications, and they get paid money also. That shouldn't happen. Like, it should not be a for-profit industry. Absolutely not. And also, we're not treating the cause. And Shaman, hello. With your diagnosis, you have no relief of relapse. I suffer debilitating pain daily. You really don't have to. So the pain is caused by inflammation, and your inflammation, unless you've had an accident, the inflammation disease is caused that your immune system is fighting some type of infection, some type of parasite. And so as long as you stay on the path you're on, you're going to suffer terribly. But if you decide, even changing your diet can make a big difference in pain and inflammation. That's the first step. And that doesn't cost anything. And I've got lots of information of that online. And then if you need help with, just watch my videos. I've got a lot. And I share my masterclass training. I share all the steps that we take. And I've had a lot of people just watching my videos and saying, Pam, this has changed my life. So it's all available to you. You don't have to live like this. And I'm so sorry. My heart goes out to you. Kevin, are the new blood tests for MS biomarkers picking up this MS parasite? No. Any blood tests that they have, they're only interested in trying to pick up markers of immune function and immune dysfunction. So that's what they're trying to do. I don't know which new tests that you're talking about, but Octave, I haven't looked, I'll look that one up for sure, but they're not looking if you've watched my videos, there is the 2017 McDonald criteria. That's the criteria they use all over the world on how we diagnose and how we treat multiple sclerosis. And that panel of experts that's making these decisions, they say they believe there's no value in looking at the spinal fluid for infections, for parasites. They're not interested in that, because once they do that, they can't prescribe these immunosuppressive drugs anymore. So they always want us to be taking a drug for the rest of our life. And it's shocking how expensive these drugs are. It's literally shocking. Hello, Lee. You're so very welcome. Hi, David. Just a couple more questions here. Is there a good way to clean the central nervous system? So that's a good question. Keep in mind, we have this amazing immune system, right? We really want to support it. We really want it to be able to work to its full potential. So the base camp of the problem is in the gut. The biggest concentration of the parasites are in the gut. So remember, I shared with you how they gave the stool from healthy people to people with MS, and some of them became symptom free for many, many, many years. They weren't treating MS, they were just treating constipation. And then also the other studies, like Dr. Perlmutter has done studies with that also. And then I shared with MS, like how, let me just go back to it, but just like the gut dysbiosis, right? How it's known that people with MS have gut dysbiosis. And we've had all of these problems years before we had our first MS attack. And so it's really important to just work on the gut. And yes, we can actually use like the oxidizing agent. We can do it orally too to clean up the blood. And then we do use the parasite drugs. There are some that will cross the blood-brain barrier. And we don't know exactly like how much of the parasites we are actually treating in the central nervous system. We know that they can be present. So Dr. Alan McDonald found those parasites in people that died of MS. So maybe if you've had MS for, I don't know, like a year or two, maybe you don't have that many parasites in the central nervous system, but the lesions are definitely inflammation. Which ones they are, we don't know. So it's a combination of things. Like a lot of the herbs are not going to cross the blood-brain barrier. Maybe a little bit of the oxidizing agent can. But what we have found is that when if you test well for parasite drugs and the ones that cross the blood-brain barrier and use them, but you do all the other steps to first support the body, and then you really work on the gut, it's life-changing. So back in the day before we knew about parasite drugs and we knew we had parasites, but we had no idea that we had 2-foot worms and flukes and all of these ones that I've shared tons of pictures. If you're new, make sure to go back and look. But we used herbs, and a lot of students were able to become symptom-free just with using herbs, which only would have worked on mostly just the gut. And if you're more disabled, we found that the herbs were not enough on their own. So focus on the gut. That is something that you can do, and obviously a layering of therapies where we're using herbs and parasite treatments, and we're using oxygen type therapy. So we're kind of hitting the parasites on different angles, and that's what really works. Hey, Joe, nice to see you there. You're so very welcome. Awesome. So he just shared, you've helped me far more than many of the doctors that you tried on the way until he finally found. Awesome. I'm so happy for you. You are such a researcher too. And then last question here. Stephanie, are regular tabs able to get rid of these parasite infections? I don't know what labs. Are the regular labs able to identify the parasite infections via stool samples? No, they're very, very poor. We don't, unless let's say if you have a medical plan where stool tests are covered and you don't have to pay for it, sure, get one done. You probably won't really find anything. It might show certain smaller parasites like Blastocystis hominis or Entamoeba, like certain protists, but they really don't pick up the parasites, unfortunately. What about ozone directly to the brain? I think that would be too toxic, I'm pretty sure. And okay, super. Tracy, I didn't know if you were the Tracy that's in in one of my students or not. So I can't see your face, so I wasn't sure if that was you or not. Oh my gosh. So she just shared here, I just wanted to share this, that she just started with me 10 days ago. And, she doesn't have MS, but she has all kinds of like pain and all kinds of symptoms on tons of supplements. And she's worked with so many different practitioners, and she just was not getting anywhere. And she was in a lot of pain and she couldn't walk. And I just said, stop all these things. Let's just get down to a baseline. Let's get the carbs lower. Let's get down to a baseline. And so she said, today I woke up and I skipped my first 2 doses um, of the medications, and it's been 4 years since she did that. That is amazing. That is so cool. And so that's the thing. Things can change pretty quickly when you do the right things. And we've been doing this for 10 years, at least in large group settings. So we've been working with students from all over the world, over 15 countries, and with not just multiple sclerosis, but many other conditions also. And so we have learned a lot, and we want this to go mainstream. We want the doctors to take this over, but there is this blindness that, and it's not just arrogance. There's a lot of doctors that really believe that, these MS drugs are the answer, and it's really, really sad because people are suffering. So honestly, if you're at a place where you're like, I am so fed up with this, I am done with this, I want my life back, what I've been doing has not been working. I'm not living my life. So if you're at that place, make sure to watch my masterclass training. I tell you all the steps. There will be a link beside this video. Make sure to watch it. Come to our website. My blogs are amazing. You will learn so much, the posts that I do every week. I'm heavily into research. I have a science degree. My background is teacher. I've been a coach for over 10 years, and I've recovered from MS, and we have helped so many people. And our Live Disease Free coaches that work with us, they also have recovered from chronic disease. So you'll always be learning from somebody who has done what you want to accomplish. So watch my masterclass training. And if you need help, reach out. Don't wait another day. Don't suffer any more than you have to. It can change really quickly for you when you're doing the right things. And if you find this research really helpful, if you want our doctors to start taking this over, please share this information, these videos, with doctors, with nurses, with chiropractors, with any practitioner that will look at it, or groups of people, because very often it has to come from the people. It has to come from those of us that are suffering to get the word out. So with that, I hope you have a wonderful week, and I will be back next week. Take care. Bye-bye for now.